The clinical examination of the traumatized patient and the types of bandages. So the clinical examination. Check the wounds, the open injuries, any synovial infections, closed injuries like a rupture or penetration, and search for bone fractures. The emergency help and stabilization of the patient to the clinic. So use anxiety relief and pain relief. For sedation, use alpha-2 agonists like xylazine and etomidine. Do not use acepromazine. And for orthopedic painkillers, use COX-2 painkillers such as firocoxib. And be careful because avoid this in severe hydration or shock. So you need to stop the bleedings, prevent any further injury, and the wounds use sterile coverages and gauze bandage, and support the weight bearing in an abdominal sling. And for fractured limbs, apply a poster and splint. This is for short-term immobilization. And when there's a fracture on the front limb, have the head directed backwards. When there's a fracture on the hind limb, have the head directed forwards. So examination. If the heart rate is above 80 and there's poor peripheral pulse quality, the animal could be in shock and it needs IV fluid support. And check the pulse quality, the respiratory rate, check for the signs of dyspnea, check the mucous membranes and the capillary refill time. Check the skin turgor, the mucous membranes, the eye position and the hematocrit and the temperature. So examination of the injury. Check using a distant examination, see if there's any swelling or lameness. Number 2 is palpation, check for the wounds and search for any foreign material. Number 3, so assessment. Use x-rays, localization, see if it's complete, incomplete, communicated, displaced, non-displaced, articular or non-articular. And assess the involvement of synovial fluid. Use positive contrast x-ray. Always perform plain x-rays prior to the contrast administration. Use aseptic preparation and inject radiodense contrast medium. And check the cartilage, the meniscal damage, synovial membrane, bursa wall, and the presence of communication. And then the assessment of the tendon injury. So in the extensor tendon injury, the result is the inability to place a hoof, so it results in knuckling over. In the superficial digital flexor, you have hyperextension of the fetlock. In the deep digital flexor, you have lifting of the toe, and the rupture of the suspensory ligament, you have complete dropping of the fetlock. And in tendinography, use aseptic preparation, meglumulene, diatriazoate, and then the aim is to detect tears. So the types of bandaging. The aim is to reduce edema, prevent hemorrhage, protect the surgical sites from contamination, immobilization, and protect from desiccation. So the primary dressing is applied over the surgical site or wound. It's sterile, it's non-adhesive gauze or gaze, and you can use chlorhexidine. The secondary dressing is applied over the primary bandage. You have padding, roll cotton, elastic bandage, and elastic adhesive tape. So for the hoof bandage, make sure it's dry. The indications are covering the hoof from surgical procedures, soften the hoof capsule. It's applied for 3 days. Usually, and so apply cotton, elastic bandage, elastic adhesive tape and silver tape. Distal limb bandage, so you cover the surgical sites or after intra-articular injections. So roll cotton from distal to proximal at elastic adhesive bandage and fix the hoof capsule by impermeable tape, as seen here. And the Robert Jones bandage is the mobilization of the joints. It's 1.5 times the circumference of the limb. Sterile gaze, roll cotton, incorporate cotton sheet, elastic band, and from the hoof capsule by impermeable tape. And the carpus bandage extends from the coronary or the fetlock up to the carpus, and put pressure relief over the accessory carpal bone. Use pressure relief pads, and it goes 15 centimeters above the carpus. And for the tarsus, it goes from the tarsus bandage, it goes from the coronary or fetlock up to the tarsus, and put pressure relief pads on the common calcanean tendon. So make sure it goes above the carpus as well, and incorporate relief pads on the palmar area of the tarsus. And the problems are, it can be too loose, it can be slipping, tight, pressure necrosis, uneven tension of the bandage, and contamination.